back. This is Boomer Life on CL 650.
Welcome back. You're listening to Boomer Life on CL 650. I'm Joanne Sutton. Today's conversation is all about Alzheimer's disease and other dementias and the research being done locally to find a cause and a cure. So adding to that conversation right now, we say hello to Dr. Cheryl Wellington. So have we caught you in between classes, Dr. Wellington?
No, you've caught me in between meetings, but I'm delighted to be here.
Thank you for joining us. Now, Dr. Wellington is a professor of pathology and laboratory medicine at UBC and is particularly accomplished in the area of dementia and traumatic brain injury. So, Dr. Wellington, we're really happy to have you joining the program today. Could you talk a little bit about what type of research you're actually involved in? Because from what I understand, you have quite a breadth of subjects around dementia research, so maybe you could share a little bit of that.
I'd be happy to, Joanne. So I'm what people call a basic or fundamental science researcher. I'm the kind of researcher that tries to figure out how to do something differently or how a disease is caused, and have the first few attempts at trying to fix a problem, usually using some form of test tube type of experiment. There's a lot of research that needs to be done in between clinical studies and clinical trials. So, for example, when patients come in and the clinicians are puzzled by some of the questions they don't understand, they turn to people like me to say, go try to figure this out. And then I go do my work in the laboratory and then come back and talk to the clinicians. And then that's how the progress is made. So the type of work that I do is really behind the scenes, and it's focused on the very fundamental principles of how Alzheimer's disease occurs and what new cutting-edge methods or ways can we try to understand the disease, detect the disease early enough to try to treat it effectively, and then design the new potential drugs that could be tested in clinical trials.
So we could also call you the chief problem solver.
More, my people, they have a nickname for me, which is the idea hamster.
Oh.
So I run on this idea wheel all the time. And, yeah, it is problem solving for sure. And I really enjoy this challenge. There's a lot of new ideas that are tested, and some we discard right away, and some we continue on working for years, and then the cycle continues, and we can deliver new options for the clinicians to try and help either earlier detection, better management, or new ways to treat dementia patients.
So where are we today in 2016 as far as cutting-edge therapies or technology? How would you describe that?
In a nutshell, I think we're at the most exciting time in the history of dementia research, given the tremendous advances in all sorts of fields of medicine and science that might at first glance seem unrelated to Alzheimer's disease, but putting them together means that we can tackle Alzheimer's disease detection in a way that we have never been able to do before. And these sorts of possibilities is what is leading Dr. DeMarco and I to propose a number of cutting-edge research projects where we will be attempting to define blood-based signatures or screens of very, very early Alzheimer's disease, and much better ways to measure disease progression and the effectiveness of any treatment. But these are methods that originated not by specifically studying Alzheimer's disease, but studying very, very basic processes in the body. And we now, Dr. DeMarco and I, can see the opportunity to apply these methods to Alzheimer's disease.
Well, actually, I'm quite encouraged that you've mentioned Dr. Mari DeMarco, because she is sitting right here beside me. The two of you have done a variety of work together. Tell us about the actual work that you've completed as a team.
Oh, well, do you want to address that, Cheryl?
Go right ahead.
Well, I just wanted to sort of reiterate what Cheryl said, that we're seeing a lot of exciting things from various fields, not necessarily those directed at Alzheimer's, even things from diabetes, and that we're starting to see how they might apply to Alzheimer's disease, and that's really exciting. And from my perspective is how we can take those things and make them into clinically useful tools. And so that's where Cheryl and I kind of collaborate at that place between what's a research study and then what can be moved into clinical care. And so I'm more on the medical side of things, and so we can kind of have that push and pull between us and sort of bring things across that void that is quite difficult to do at times.
So, Dr. Wellington, how would you comment on that, about the work that you've done together?
It's been a phenomenal project thus far, and we are just at the beginning of it, really. The next 2 to 3 years, we'll see tremendous advances in the work that Dr. DeMarco and I can do. And what is really wonderful about our project, is that it really highlights the Canadian investment into research across the board. So the benefits to this is sort of homegrown across Canada through national platforms, and so we are very excited to be able to take those investments that Canada's already been made and turn them back around for health benefits to Canadians.
Well, I find it very interesting that you're trying to make, it just seems you're broadening your knowledge and your research, and you're trying to make connections between Alzheimer's disease and other possible illnesses. Now, Maria Howard mentioned earlier that you recently participated in the 2016 Alzheimer Update out at UBC, and you talked about brain health and heart health and how those relate. What else can you tell us about that?
There are a lot of factors that affect brain health that traditional neurologists or neurology, the field of neurology, would rather ignore. And now we understand how the brain works in context with the entire body, especially with respect to inflammation. So white blood cells in your bloodstream control the response to inflammatory stimuli, so infections or other things that happen to challenge the immune system. This happens as well in brain diseases like Alzheimer's disease. And some of the cutting-edge work that we are just about to get ready to publish really demonstrates how a particular form of cholesterol-carrying protein in the blood can markedly affect how the brain responds to inflammation, especially the kind that is produced by A beta, which is part of the major neuropathological pathway in Alzheimer's disease. The benefit of this research, or the really exciting part of this research, is that it really helps define, perhaps understand a little bit more about how what is good for the heart is good for the brain, but also even more exciting and leverages into Mary's work is what new tests can we develop to be able to measure this effect. We know that just measuring the cholesterol content is not enough. We need to do something more, and that's why we are right now very busy in the lab with very exciting work to try to figure out how can we measure this really important function, and how can we apply it to Alzheimer's disease.
Well, I think you've already identified yourself as the idea hamster. I'm sure you'll be able to come up with an answer for that. Can you tell me about any personal connection you might have with Alzheimer's disease? Is there a reason you got into this research?
Well, like most people, I have relatives with Alzheimer's disease. But what really drives me to this field is the intellectual challenge, the importance of the magnitude of the challenge. We need to do something about Alzheimer's prevention and treatment within our generation. What's most exciting is that over the 20-some-odd years that I've been in the field of neurodegeneration, I believe that we are very close to having some transformative understandings happening in the next few years that can be rapidly applied to the field of dementia. So I could not be more thrilled to express gratitude for being in this field and for the people that support the research and participate in the research, because your investment is well taken care of, and we are very close to delivering new ideas of how to measure, how to detect, and how to possibly prevent or treat Alzheimer's disease.
Well, it's great to hear you so excited and so passionate about what you do. And I think you've also just given us some hope as well that there is something on the forefront. Would this be directly related to the research that you and possibly Dr. DeMarco are doing right now?
It encompasses our research for sure, but it also places our research in context with many people around the world, all of whom are pulling together to try to solve the problems of Alzheimer's disease. Certainly, the take-home messages that are already out there are, well, we know what's good for the heart is good for the brain, so exercise and diet do matter, but we're trying to do more to be more specific on what exactly is it about diet, exercise, and what it does to basic metabolism that can affect risk of Alzheimer's disease. Dr. DeMarco brought up the context of diabetes, and just to use that as an example, nowadays we have blood tests that people go in and they get screened for diabetes. Before those tests were available, however, there were people in the lab doing research on how do we find this out? How do we tell if somebody's developing diabetes? And then how can we treat it? That's kind of where we are with Alzheimer's disease right now. But we have a lot more tools that we can apply to trying to figure out which of 100 possible tests might be the one that was really useful for Alzheimer's disease.
Dr. Cheryl Wellington, thank you so much for your contributions to the Alzheimer's research and dementia, and thanks for your contributions today on this program.
You are very welcome. Thank you for the opportunity.
Excellent. Maria, any words on how essential this research is and the role that these doctors play in researching for a disease that has no known cause and no cure?
Oh, it's incredibly essential. As Cheryl said, there's lots of things that are going on, and families are looking and hoping for something to help them feel confident that this will change for other people who haven't yet experienced it. But I think it also helps families understand that those practical ideas, in the absence of a treatment or some type of test, things like exercise and diet are still really practical elements that people should be following and committing to. And so I think it brings a wonderful message that you just have to keep focusing, keep trying, and we will get there, as Cheryl says.
This is BoomerLife on CL 650. You've just met and listened to Dr. Cheryl Wellington, a professor of pathology and laboratory medicine at the University of British Columbia. Also in studio today, we have Dr. Mari DeMarco, a clinical assistant professor in pathology and laboratory medicine at UBC. She's also a clinical chemist for St. Paul's Hospital. Plus, Maria Howard is here, CEO of the Alzheimer's Society of British Columbia. We are learning about the importance of research in finding a cause and a cure for Alzheimer's disease and other dementias, and speaking with the experts on this topic. We'll take this national in just a moment, and we'll meet Dr. Larry Chambers next on BoomerLife on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.